Type 2 diabetes. The body does not produce enough insulin for proper function, or the cells in the body do not react to insulin, insulin resistance. Approximately 90% of all cases of diabetes worldwide are type 2. Some people may be able to control their type 2 diabetes symptoms by losing weight, following a healthy diet, doing plenty of exercise, and monitoring their blood glucose levels. However, type 2 diabetes is typically a progressive disease. It gradually gets worse, and the patient will probably end up have to take insulin, usually in tablet form. Overweight and obese people have a much higher risk of developing type 2 diabetes compared to those with a healthy body weight. People with a lot of visceral fat, also known as central obesity, belly fat, or abdominal obesity, are especially at risk. Being overweight/obese causes the body to release chemicals that can destabilize the body's cardiovascular and metabolic systems. Being overweight, physically inactive, and eating the wrong foods all contribute to our risk of developing type 2 diabetes. Drinking just 1 can of non-diet soda per day can raise our risk of developing type 2 diabetes by 22%, researchers from Imperial College London reported in the journal Diabetology. The scientists believe that the impact of sugary soft drinks on diabetes risk may be a direct one, rather than simply an influence on body weight. The risk of developing type 2 diabetes is also greater as we get older. Experts are not completely sure why, but say that as we age we tend to put on weight and become less physically active. Those with a close relative who had type 2 diabetes, people of Middle Eastern, African, or South Asian descent also have a higher risk of developing the disease. Men whose testosterone levels are low have been found to have a higher risk of developing type 2 diabetes. Researchers from the University of Edinburgh, Scotland, say that low testosterone levels are linked to insulin resistance. Subscribe us to know more health tips and home remedies.